Certainly, we're seeing some stabilisation in numbers. We've got, 400 to 500 cases each day. That has been more or less the average for the last week. That's not good enough, but it is a positive that we've averted an exponential increase through the last couple of weeks. If we hadn't stabilised these numbers, we would have seen thousands of cases per day, and there are estimates we've averted 20,000 or more cases by virtue of the stage 3 restrictions. But as I say, that hasn't been enough. That's been able to stabilise the numbers, but we cannot have 500 cases every single day and the associated morbidity, hospitalisation, intensive care requirements and deaths that are associated with that number every day. Stage 4 restrictions will make a difference, but we won't see them for another week or more. But we can drive numbers down, and we will drive numbers down. The ongoing challenges will be in the outbreak settings. We know that aged care is particularly vulnerable. We've got over 1,600 active cases in aged care at the moment. Our healthcare settings are another area where we absolutely have to make sure that we can protect everyone in those settings. The other outbreak settings are our high-risk industries, and I spoke yesterday about disability settings. Even though the numbers there are significantly less than in aged care, it needs the same coordinated and rapid response. There is a rapid response outbreak unit that coordinates in the same way the emergency management operations, the Commonwealth and state responsibility to manage cases in those settings. But across all of those outbreak settings, we really need both a prevention, a rapid response, and then as community cases are driven down and there's less introduction of virus into those settings, we really need to make sure that they are protected from any further cases. If they become COVID-free, if those outbreaks are ended, then we absolutely have to make sure that they remain COVID-free. That will require all of the things that we're trying to get in place now, but some real vigilance and with a particular focus on staff and the very first symptoms that they might develop, and to make sure that they're isolating at the very first instance. But it's all of those elements, including the personal protective equipment, the training and the rapid response that needs to be in place.
Professor Sutton, can I just ask you, there are reports today that 1 in 5 healthcare workers are reporting shortage of PPE in their workplaces. Is that good enough, and what can be done to help them?
I might have the Premier speak to that. My understanding is there is no statewide shortage of PPE. There is no bottleneck in terms of distribution to any healthcare facility and to healthcare workers as is required. So there's certainly no lack of PPE in order to protect those healthcare workers. But I'll get the Premier.